Welcome everybody to Native Strong. We're back, all the three of us, once again, and I think we get to see some representation of our Indian Health Service at work, right? Maybe someone can break it down and let us know what we're about to see.
So, yeah, I apologize if we're not able to hear sound, and let me know if you're able to see the video, I guess, Mark or Dr. Gnase. But this was a ask by Wisconsin DHS to kind of provide a local face, physician to put to, the message of, vaccines being safe, and, Dr. Gnase himself obviously receiving the vaccine live on Facebook now, many months ago. So this was a production that they came in and, got Dr. Gnase to sit still-ish for an afternoon, many takes of, talking about the vaccines and what he thought about them. And obviously he got his own. And so I'll just hit play here and we can kind of go through. And again, I apologize if we don't have sound, but I'll share the links out in the chat bubble as we move forward here. Yeah, thanks again for tuning in, and here we go. So with that, Dr. Gnase, I think I'll give it back to you if you want to share your screen again.
All right, that's as good as it gets. Sorry, folks.
I'll share the links out in the chat so we can you can all listen to those with sound on them. Yeah, so I think went well. There's a couple different versions of that. Couple that are different positions throughout the Milwaukee or southeastern Wisconsin area. There's lots with just Dr. Gnase. There's a couple that are kind of representing all kind of the demographics of Wisconsin. So I think they did a good job, and of course Dr. Gnase did an amazing job, and hopefully he doesn't leave us for an acting gig after this. Gets widespread publicity around the state. So, so with that, it's been a couple weeks, I think, since we've been here. Thank you again for joining us. We will, obviously, as always, welcome questions as we go through the session today. You can drop those in as a chat bubble in via Zoom, or we are streaming via Facebook Live, so you can drop in a comment there as well. I think it's going to be more of a question-focused session today. But Dr. Gnase does have a kind of an abridged presentation, so we'll get to that. But first, I want to welcome back Mark, our good friend here, who was I think was kayaking or doing some other fun stuff last weekend or last week around. So thanks again for being with us, all of you who are in the chat with us. Thanks again for being here, Dr. Gnase, and of course, thanks for coming back with us, Mark.
So I think, Dr. Gnase, everyone out there, to let you know, if you're new to this process, when you move your cursor around or that little arrow, because it is Zoom, you can also ask questions, because some people are shy to ask them in person or show their face on screen. I know students I work with can be quite shy. There's a chat bubble, chat box within your icons. Just click on that, and then you'll see like you, and it'll say me to everyone. And then you can put your question in there if you don't feel like asking it on screen. The other piece is, please ask questions that you've heard and you may know the answer to them, but you want that answer to be maybe just a little bit stronger, or to at least be able to say, hey, I watched Native Strong. I was on with Dr. Gnase, and I got some answers that may help round out the answer you have. and you can reference that, because sometimes when we're talking about our health, what we get into, instead of a conversation about how we can get better, it becomes a conversation of the manner and a debate almost in which you're to be healthy, instead of saying, there's a path to health. And that's why we're here. So let's go over to Dr. Ignace and take a look and see his presentation about our community, where we are with the virus, with the variant. And there's always new information coming out almost every day, just as it was last year when we were in the midst of a COVID-19 struggle of proportions that I think a lot of people may already be forgetting. So Dr. Ignace, let's go over to you and find out the latest that's happening for our community and communities around us and for our country. Dr. Ignace?
Jeremiah and Mark, thanks for the introduction, and it's good to be back. I took a week off, so it was good to take a break. And so in coming back, I'm really trying to focus more about just giving some quick numbers, but I'll try to give the latest up-to-date information as Mark was talking. But one project that I was part of most recently was really about this multimedia campaign that Wisconsin DHS, Department of Health and Services, launched called Our Doctors. And this was really an effort to get a collective effort from around the state of all types of providers and healthcare service industry workers to really promote the vaccine campaign. And so I was fortunate enough to be an individual. They asked to be part in the southeastern part of the state, and Jeremiah will post these links out on the chat, and we'll get this out on our own platforms as well. But southeastern part of Wisconsin, as well as it looks like even the northern part of Wisconsin will also be. I'll be part of some of these segments, so it'll be interesting, and I'm sure we'll get some immediate feedback right away. But it was interesting to do and fun, and I told Mark and Jeremiah not to laugh at me, so hopefully you guys won't either. So let's get into some numbers here, and I want to jump right into what's going on here in Wisconsin. So June 24th, I think, was my last. Oh, I'm sorry, July 1st was my last segment that I presented, and these are a little bit out of order, but this really goes into a discussion about not just coronavirus, SARS-CoV-2, but what's going on with the variants, because that's really what's going on now. We're still seeing primary infections with the original virus, but obviously with discussions about the variants, that's becoming even more important. And there's one new variant that has come out, and it's called Lambda. I haven't updated that segment here. We haven't seen it here in Wisconsin, but it is Lambda. It's out of South America, and that this one is going to be a bit more dynamic than what we've seen so far, because it has multiple mutations on the spike protein. But I'll circle back and discuss more about what that is. But we see in South America this new variant called Lambda. I still suspect and sense that there's going to be another variant that comes out. Right now, it's primarily Delta and the Alpha B117 and the Delta out of India. When we look at what's occurring here in Wisconsin, we still see primarily the variant that's predominantly out there is Alpha, and that's number one, and number two is Delta. But when you look at the breakout of where this is occurring, the northeastern part of the state. So that would be like Shawano County, Menominee, and up towards Forest County and in that region. And if people remember, this region was probably one of the hottest spots in the country at one point back in September, October, and November, not just in Wisconsin, but in the country. So it's a bit interesting to see that Alpha became predominant, and now Delta is now becoming predominant. The rest of the state, yes, they're seeing Delta. And when you look at the top half of this table here, and I apologize because I put this out of order, but you see July 14th, when you compare July 14th to July 1 under Delta, you see there's 101 infections of Delta. From 2 weeks ago, it was 71. So there's 30 new, at least documented cases of Delta out there. And so it's not a lot, but it is becoming the predominant infection. And just like what we're seeing throughout the country, and people are hearing reports about this all the time, is kind of twofold. One, we know about the individuals that are getting vaccinated. We know that the effectiveness of the vaccines are really good, not only against the original virus, but also against variants as well. Now, there are people who are getting breakthroughs, infections after being vaccinated, but the numbers are very few. What hospitals are seeing, and pretty much everywhere throughout the country, is areas that have low vaccination rates are now seeing a bit of a surge in the number of new infections. And predominantly what people are seeing, what's being reported out of hospitals and ERs and admission units, is that the individuals that are primarily being admitted are the younger groups in the 30s and 40s. And what they're finding is the vast majority, and the vast majority, I'm talking about 90% plus of the individuals that are newly infected or being admitted to the hospital are unvaccinated individuals. So that's certainly consistent with what I'm seeing here in Wisconsin, and what people are hearing throughout in the news media. So just to kind of give a quick update, and this kind of goes along with this uptick and surge in numbers here in the United States. Now, this is a slide from Johns Hopkins and their resource, and this really is to illustrate the kind of uptick that we're seeing in cases. Now, I just mentioned reports from just about every state and throughout the country, and the CDC certainly echoing this as well, is that the regions with the lowest vaccine rates are beginning to see an increase in the number of infections. So what's interesting here also is in India, again, we see these numbers. If you look at the red graph, you see that there looks like what appears to be maybe another uptick or surge in the number of infections. Now, Delta, remember, it came out of India, and that seems to be the primary driver variant in India. So 1.4, almost 1.4 billion people live in India, whereas they've only had about 400 million vaccines given. That's not a lot comparative to what is occurring here in the United States. And right now, there is another uptick in numbers occurring in India. Looking at Israel and the United Kingdom, we see kind of the same pattern starting to emerge. Now, at one point, Israel was recording no infections, if any, very sparse numbers, almost every other day, every third day. But in the last couple of weeks, they've seen uptakes in numbers, and now Israel is actually seeing 1,200 new cases. Same in the UK. I had mentioned a couple of weeks ago that Prime Minister Boris Johnson had come out and said, hey, we're going to be extending our lockdowns until July 19th. Well, at the time, the numbers didn't pan out as to the reason why he made that announcement. And shortly after he did, in the subsequent days and weeks, we see that the numbers in the surge of infections are starting to take off. So there was a bit of some insight here as to what was going to happen. And the Prime Minister extended that to July 19th. I suspect, given on what the numbers are showing now, he may extend that even further. So the Delta variant is now becoming the kind of the hottest thing to discuss, and how countries and communities move forward given this new variant, and what the impact is going to be. When we start looking at what's occurring back here in Wisconsin, so on the left-hand side is the total population of single dose. It's vaccine is 50.9%, and you can see the age group distributions have a pretty even progression of vaccinated individuals by age group as people get older. On the right-hand side are people 18 years of age and older. You can see where the percentage now goes up to 61.9%. And so these are all good indicators that individuals are continuing to get vaccinated, however, at a very slow pace. At the bottom half here is listing the number of individuals that have received at least a single dose, and by race and ethnicity. And on the right-hand side, you see what is in yellow boxes is kind of the number of new vaccines being given to individuals. And you can just see over the last 6 to 8 weeks that this has a continual progression that's going down and down. And not just one particular group, it's everyone, it's every entity here in Wisconsin. And this isn't new, this isn't special or unique to Wisconsin, it's occurring everywhere throughout the country. Here we see the total number of individuals who've completed their vaccines. So that's just a quick snapshot as to the overall total vaccines being distributed. Here in Wisconsin, almost 5.7 million cases, doses being administered. As of July 14th, on the average, right now, 7-day average is about 8,000 doses being given out per day. Looking at the 12 to 15, we see that given the total number and the 7-day average, it is continually going down and down and down. So we're now at 340. Reason why I bring this up, this particular is and we're all going to be hearing about this really soon, is going back to school. And we're already hearing about discussions about colleges and universities and how many of schools are now mandating vaccines prior to the school year starting. My sense at some point is that this may trickle down into the K through 12, and we're going to have a big old discussion about how this is all going to work out. So these are all important, and I'm giving you kind of the behind the scenes numbers here to kind of see where this is progressing, and if anything new changes, we just see the numbers continually going down. Just like Wisconsin, the number of doses being administered here widely throughout the United States, you just see the trend just continues to go down and down and down. So this is kind of the updated, as of yesterday, what the distribution of individuals being vaccinated by age group. We see that the total population is now at 55.7 for single dose, fully vaccinated at 48.2. Individuals 18 years of age and older is still hovering in 67%, and the total vaccinated, fully vaccinated individuals just less than 60%. So I think the last time I presented this number, as of July 1st, I had projected a range that was pretty consistent and based on the numbers of what the current administration would like to see us, the country at. The projected numbers have fallen quite short. Now, the reason why I say that is looking at just the numbers. You know, you could do some nice calculated projections here, and you can figure out how long is it going to take us to get to 70%. And looking at where we are 18 years of age and older, we had a shortfall of about 8 million people at that time to reach 70%. Well, at the rate we're going right now, it will take us about 30 days from July 4th to get to that point. Now, the rates are going to vary and they're going to change. And I projected at least 30 days from July 4th, and it may take maybe an additional week or two to get to that fully vaccinated 70%. So now we're looking at probably mid-August. If we're going to get to 70%, that magic number, we're probably looking at mid-August, so another month from now. If we're looking at the total population of herd immunity at 70%, I believe I had mentioned that it would take us close to 160 days, which would take us past New Year's and into 2022 in January to get the total population at that 70%. That's a long ways. That's a long time. And at our current rates, it just, you would think the Delta variant and the concern about the increasing number of cases, that there would be a bit of urgency to get people lined up for vaccines. And so when we start looking at where in the country these infections are starting to spike, we see several states, Texas, California. If you look down more in the midsection, you see Florida at 36,000. Missouri and Arkansas, so southern states. And then we kind of have these lingering, non-changing numbers in the state of Washington, in the state of Arizona. So these states are starting to see a bump in numbers. As of yesterday, if we look at Wisconsin, Minnesota, Michigan, we're kind of at the bottom tail end. But as you can see, each one of these states, Wisconsin, Minnesota, and Michigan, our total numbers for the last 7 days are starting to increase as well. So we're going in the wrong direction, and that is a bit concerning, especially with the school year start fast quickly approaching. We look at what's going on in the native communities of each state. We see that Michigan has had 27 new infections in the past week, 11 in Minnesota, and 12 in Wisconsin. So if we look at kind of the historical pattern of what's been occurring in each one of these states, we see that there was a decrease, and now we're seeing kind of an uptick in numbers. So this could be kind of the beginning indications that we're going in the wrong direction now. As of yesterday, the 7-day average is now 139. And again, I mentioned this before, that it looks like we're going in the wrong direction. So The last time we were at 139 average was April 16th. We were as close as March 21 when this all originally started, but now it's starting to slide upward. So that is concerning for sure. Now, I had mentioned this before, but I wanted to give kind of an update. So case rates, we see the native population is second in the state of Wisconsin, hospitalizations second as well, and the fatality rate is still the highest in the state. Those have not changed. If we look at hospitalizations, now I had mentioned before this age group 35 to 44, the native population has the highest hospitalization rate, and this is really going to be determined on any given day or any given week. These rates are going to change, and so I suspect that the native population hospitalization, which basically means new infections, that this will continue to be the case until something changes, like people getting vaccines. So vaccine rates, this is kind of important, and you kind of have to read between the tea leaves here a little bit. So when we look at 18 to 24 vaccine rates, as you go from right to left, you see these these stacks of numbers on the far left. On far right, this really tells you, like, from week to week what the rate of change has been. So in the past week, we see that the African American community had a +13, the Native community +17, and so forth. So you see that there is definitely a continued effort for race and ethnicities to increase their vaccines. And you can really gauge as to which population, subgroup of the population is going faster than others. And so the Native community appears to have plateaued here. And so it's going to be important that we continue to spread the message and keep it informed about how important it will be moving forward to get vaccinated. So we look at the age group of 25 to 34. Again, we see kind of a slowing of rate change of the native population of +12. It's actually gone down. So this age group, 25 to 34, we're beginning to learn that this is a very important age group that needs to be vaccinated, and in the Native community, that rate has kind of stalled. Looking at 35 to 44, again, a plateauing has occurred with +19. Certainly a little better than some other groups, but at the same time, kind of smack dab in the middle. We look at vaccine rates of all ages. We see a +19 and a plus for Hispanics, +13 for natives, +13 for the Asian community, +12 for the African American. So we're right pretty much at the same pace as most groups here in the state of Wisconsin. Now, I will continue to bring this back because this is really looking deep into the weeds here as to what are the patterns and trends that are going on here in the state. So if you look on the right-hand side, you see these red dots next to age groups. This is the number of new infections that have occurred. Now, because I didn't report out last week, I skipped last week. So this is July 14th, the bottom half is really a reflection of what has been going on for the last 2 weeks. So this is a sample size, a sample of a 2-week time frame. But again, the pattern that is occurring now is a little higher than it was what I reported out on July 1st. So if we look at July 1st, we see the age groups of 20-year-olds, 30-year-olds as being number 1 and number 2, not only in new infections, but also in hospitalizations. When we fast forward to July 14th, we see that same age group, the 20-year-olds and 30-year-olds as being the number 1 and number 2 age groups for new infections, and the number 1 and the number 2 age groups for hospitalizations. Now, that's one of the reasons why I keep flashing these numbers of vaccine rates, is really to look at how fast or how slow the vaccine rates are occurring in these age groups of 18 to 24, 25 to 34, 35 to 44. This really gives you a sense of what is occurring. And as I mentioned, these age groups, specifically looking at natives, has plateaued. So that is the concerning part, knowing that the number of infections are starting to go up, and we know that the number of infections, the vast majority, are the result of people that are unvaccinated. So it's really important to look at what's the vaccinated rate, how that's occurring here in the state. We see it's plateauing for the native community, so I am concerned that this is really prolonging our effort to really squash this virus, especially in the native community. So it's a lot of information, it's a lot of numbers, but I give you the short version, the Cliff Note version, to really hone in on what the key points are. And I'm going to turn this back to Jeremiah and Mark for any questions or comments.
Okay, Dr. Ignace, since it has been a couple weeks and I've been out there talking to folks, I have lots of questions. I think, well, I know that we go to usually the top of the hour. So one of the things that we know now and that you've been highlighting in the program is that Native American health disparities have left us vulnerable to COVID-19. So for those of us that have been fortunate enough to be paying attention, to take precautions, to get the shot, kind of what's your advice to those folks like myself out there now? And here's an example. In the very beginning, we were given these kinds of hand sanitizer pieces.
Oh.
Now you see them being sold at secondhand stores and all kinds of things. There's one with the Gerald L. Ignace Health Center logo on it. And we get this kind of thing like, and there'll be several questions to this, so I'll go one at a time. Should we still be using hand sanitizer on a regular basis, trips to stores, coming in and out of the house, working with relatives in a home that's been vaccinated or a mix? What's your advice for folks out there dealing with these bottles?
Yeah. So that brings up a pretty interesting question, because we all deal with this notion of transmission of COVID, and we really, I wouldn't say we went overboard, but we were pretty diligent about keeping hands clean, don't touch your eyes, nose, or mouth, that kind of thing. And the primary factor of transmission is the respiratory droplets, without a question. But I think what's important is to know is, are we just looking to prevent COVID, or are we looking at preventing from all other types of infections as well? Other viruses, other common cold viruses. And so I had mentioned a couple weeks ago that in the state of Wisconsin, things like rhinoviruses, adeno, influenza, other seasonal coronaviruses were on the uptick, and these are the ones that cause just general colds in collectively. Now, when we talk about hand sanitizer and contact spread, I would say it is still a good idea to maintain kind of that routine, because if we're not just talking about trying to prevent the transmission of COVID, but we're also looking at now the prevention of other viral respiratory illnesses, RSV, parainfluenza, other seasonal viruses that cause the common cold, and even bacterial infections. And so just as a habit, I think it's important. And what we may find out is keeping our hands clean and still preventing, touching our eyes, nose, and mouth is still using the alcohol hand sanitizer. So that is still a good way to prevent not just COVID and respiratory droplet transmission, but also other viruses that can cause it. So one kind of transcends into the other, and it's still a good habit and routine. If you're looking at preventing from getting sick, I still use it between when I go get my gas, I use the gas pump, and I'll still use hand sanitizer. And it's more out of routine now. But I will say I haven't been ill since 2019. So I think it's still a good idea, in its prevention.
Jeremiah has a question in there, and we'll get to that after this next one, which is a follow-up to the hand sanitizer. We're going back to pause. I know that folks are back to some of their ceremonies, and some of those there's still challenges around that because Canada has different rules around COVID-19. So having that population and us come together has been quite difficult. But here's a question that came from a grandparent at the last gathering I was at of Native people. And that was related. So here's the thing, is when they're vaccinated, they live in tribal community. When they encounter someone with a mask, they're often kind of wondering, is someone making a political statement, or should they be modifying their behavior? This comes from them reading an article that those folks who have had vaccinations are the largest spreaders of variants. Now they just saw one article. I couldn't answer that question, but they said the last thing they want to do is to be spreading the virus. But then when they're greeting a friend, or they're at a powwow, or they're going to go to ceremonies, they see someone with a mask. How should they be behaving around that person? Should they be creating personal space? Should they be asking permission to come into space, or how, or what's your kind of impression, or what have folks been talking about at that professional level about how do we approach those folks that do have masks? They're out there in public, or even at our family gatherings.
Yeah, and this is so obviously an individual that would wear a mask may not be vaccinated, or they may be vaccinated but just have an extra level of precaution. Remember, masks are really the prevention of spread of the individual. Yes, it does also help protect you from exposure, but masks, as masks are now, is really looking at the prevention of spread or transmission. So intermixing individuals, and this is going to get really funky here, because we have a group of individuals who are vaccinated and unvaccinated who don't wear masks. And we may have a group of individuals that may be vaccinated or unvaccinated and wearing a mask. So you're never going to really know who those individuals are unless you ask, and that's almost kind of a rude question now to ask if someone's been vaccinated or not. So the assumption would be that I would assume that the individuals that are wearing a mask are individuals, at least out in the general public. People are wearing masks. I would think that they are the individuals that may not have been vaccinated. I would assume that, but that's, without knowing, it's pretty hard to know what their level of thinking is. I think out of respect, I think keeping a respectable distance from individuals, I think would be the most appropriate thing. and I don't know if that would necessarily limit or restrict one's behavior other than just respecting that individual space.
And so my last question from this group of, people that were talking about COVID-19 is, one person working at a kind of it's not the best job, but it's their job, right? Meaning their time really isn't their own. It's constant from the moment they clock in. 15-minute breaks are measured, right? You get that half hour, 45-minute break for lunch, or it's just an odd situation, but they actually like the work. And here's the issue of testing. Any information or updates, accuracy issues, problems, because asking to get off of work to be tested or about someone's health status, see, that's the issue for them. They don't know. They're in that gray area that you talk about. Some are vaccinated, some are not. They work in an environment where people are working closely together.
Mm-hmm.
The idea that someone asks off to get around a COVID issue, either for vaccination or to be looked at, there's some real hoops they got to jump through. So their question was about rapid testing. Not much has been heard. Is it still out there? Is it going on? Is it reliable? Is it something that someone like the person I'm talking about, who has not been vaccinated, but still has concerns and believes that the virus is out there, but not believing that the vaccination is for them, right?
Mm-hmm.
So their healthcare is more preventative. They're the person wearing the mask,
Sure.
and they're the person kind of saying, all right, I really, it's tough to even have someone listen now in the workplace to say, yeah, I'd like off to get tested. So what's your information or insights on rapid testing?
Yeah, so we are still seeing individuals with symptoms. People still are presenting with requests to get tested. And so rapid test, just so I know, there's been this huge gap between where we are testing now versus where we were even 6 months ago. So remember that a rapid test is it is a quick and easy way to determine whether or not someone has COVID or not. It's not absolute, but it is a good test. Now, we reserve rapid tests for people who present with symptoms. The efficacy or the true positive test goes up higher when people actually present with symptoms. People who don't present with any symptoms at all, and you give them a rapid test, that the true positive test may actually go down, or the false negatives may actually go up, which you don't want. So we do two tests. We do a rapid for at least immediate notification, but we also do the more confirmatory test, the PCR test, the one that takes several days to get a notification on. That is that's the confirmatory test. And so we do both at the same time, and it really is based on symptoms. So if someone presents with, nasal or a cough or fever, we will do a rapid immediately, but we'll also do the PCR confirmation swab at the same time. So, but they still need to quarantine until they get their official results, not the rapid. Okay, they need to wait until the confirmation test comes back. So it's getting tested is still, there's no quick and easy way to do it. People still need to quarantine when they get tested until the results come back.
So
Now, the
we'll
good
go to
upside,
yeah, go ahead.
the upside of that is that not very many tests are being done right now, so that there's a turnaround within about 24, 36 hours. So it's much quicker now than it was, before Christmas.
So that's great for the turnaround. Dr. Ignace, just to let you know that there are workplaces out there that when they're suspecting, these issues look like COVID-19, whatever it is, the attitude seems to be, well, you don't need a rapid test, just get the regular one. And they're looking to get just more hours out of them. before it's confirmed. It's just crazy, and it's just to me it feels like a contributing factor to what's happening with our community.
Mhm.
A lot of us have those jobs where it's hourly pay, and you're just at the whim of that employer because you're holding down 2 or 2.5 jobs.
Yep.
Anyway, it's just a social commentary, but it's happening, and it could be a contributing thing, and it's something you should be aware of. Jeremiah, more than a couple questions up there. Jeremiah, these look like ones you've run into.
Yeah, actually just from Facebook today. So the first one, Dr. Nace, was just regarding what we're seeing here at the clinic. And it was just asking if we were seeing or encountering a reluctance from that 12 to 17-year-old age group to get vaccinations. And, you know, we recently just had our kind of 12 and up vaccination clinic on June 22nd. So if you want to speak to that.
Yeah, and the reluctance is maybe a bit of a understatement. The FDA certainly has determined its safety and efficacy for kids, and I had spoken about myocarditis in previous sessions here. So these are hard decisions that parents need to make on behalf of their children, and I can certainly understand parents' reluctance to getting vaccines, and if they're reluctant, I'm sure there aren't quite more. I'm assuming they're not more willing to allow their kids to get vaccine before they do. So that kind of reluctance is present without a doubt, because if it wasn't, I think we would have seen a much higher, a much more progressive surge in the rate of vaccination in the 12 to 17-year-olds, which just hasn't panned out at all since the 12 and older have been newly eligible to receive the vaccine. You know, I think I've shown graphs where there's been just the slightest of bumps up, but that was short-lived and lasted maybe about 10 days, and then it went right back to the normal rate of decline. And we're just at that point now where half the country, you know, is it's going to be difficult to reach any high level of threshold here without the buy-in and support of not only younger adults, but also parents of younger kids as well. So that reluctance is very clear, very evident, and it's going to be hard to get that age group vaccinated.
Kind of related to that, so I've been hearing a lot of different rumblings, I guess, as far as the opening up vaccinations for the age group of either, I've heard anywhere from 2 to 12 or 5 to 12 or 6 months to 12. What are you hearing as far as timeline? I mean, I've heard August, mid-August, late August, and then I've heard September, October, November. So just curious what you've heard on that end.
So Moderna and Pfizer, and I picked these two because they're the principal vaccines here in the United States. Other countries use Johnson & Johnson, AstraZeneca, and the other many of vaccines, but Pfizer and Moderna have really been kind of the tried and true vaccines here in the United States. Now, with that being said, Pfizer and Moderna are looking at clinical trials, phase 3 trials for its safety and efficacy. And obviously with doing that, just like with the adults clinical phase 3 trials, you have to enroll a pretty good size of individuals. So that goes across all races and ethnicities, ages, that includes age group with varying medical degrees that transcend across all racial groups. So you can just imagine how difficult it is even with the rates that we have now, for parents to volunteer their children to enroll in these clinical phase trials. So it's going to be, I've heard as early as end of August that these clinical trials will be wrapped up. I've heard it being extended even into September and October, just like you've heard. So there's no set time frame other than when it happens, it will happen. Pfizer and Moderna aren't ready to submit data. They haven't closed their trials yet to submit data to the FDA. So it's going to be probably end of August, probably looking at September before this happens. And by that time, school will have already started.
All right, Dr. Gnase, so thank you again for today. I'll leave us with the final question, and then you can leave us with the last word.
Sure.
But this is from Facebook as well. You know, you're discussing the vaccination rates kind of dwindling and case rates sort of, I'm going to say surging, but, you know, on the uptick in certain places. Do you foresee a surge in Milwaukee County this fall, given, you know, the declining vaccination rates?
I see one more surge coming. I'm not saying it would be a tsunami kind of effect, but there will be a surge. Now, the reason why I say that is that, again, if we look at all of the rates and trends of what's occurring by age group throughout the state, in Wisconsin, in Milwaukee County is no different. It's just a larger scale of people versus the rural communities, but it's relatively the same. Let's just say the rates kind of plateau where they are. Well, right now, most kids are not in school. Most kids do kind of daycare, they do kind of a day camp here and there, but they're really not exposed to other kids in a classroom 8 hours, 9 hours a day like they were during regular school years. I suspect once school goes back, we're going to see an uptick in numbers without a doubt. And that goes along with the college age groups as well. So I feel we are headed for a surge. It won't be like what we had back in October and November, but there will be an uptick in Milwaukee County, and they're already starting to see numbers take a bump up.
I did have one more question just came in, and I wanted to, it seems very important to me, or to the person asking the question. So someone has a daughter who has cancer, not able to be vaccinated at the moment. Everyone else in the household has been vaccinated besides her. So what are the chances of a vaccinated individual transmitting the virus to her?
Yeah, so there's still a risk. People who are vaccinated, let's say they kind of are carriers of the vaccine. They're not infected, but they are carriers. So the risk is there. I couldn't give you a rate, but it's not zero, and it's definitely not 100%. But there is a risk. There is a risk of transmission from asymptomatic individuals who've been vaccinated to individuals who have not, and individuals who, in this particular case, with a compromised immune system and fighting cancer, are definitely high risk. And so I can certainly sympathize with the family and their household, the kind of the hypervigilance of being careful and exposure, all from all people, not just family, but people who come in direct contact with the daughter. The daughter's obviously at the most highest risk for transmission, even from an asymptomatic carrier.
All right, thank you, Dr. Gnase. And Mark, unless you have any final questions, I think we'll leave this to you for the final word today.
So my final question, and it's not going to be answered today, nor might it be answered next week, but in anticipation of the beginning, there are strategic conversations happening amongst leadership in public and private schools, and that conversation is this. before there were school-wide shutdowns. And the idea is more of a strategic approach towards shutdowns of classes or maybe a school itself. And I think the question that will be coming is, when will a principal be able to make that call? What numbers would they be looking at in infection rates or families being affected before they say, we need to shut this classroom down or we need to shut the school down? I'm not looking for an answer right now, but perhaps in 2 or 3 weeks, and maybe we'll do a couple of shows on back to school specials. But certainly that question is being asked, where the decentralization of closing of a school happen, and that call will be given to principals. So thank you for seeing your commercial. Looking forward to seeing the video.
Yeah.
Maybe we can all share in that next time, and you look great in it, and thank you for doing that. And I will say this to those of you that are watching, this Native Strong program is really important. And I'll say that because in 2017, just think about this, relatives, right? In that year of 2017, there were 19,000 folks in medical school. And guess how many folks were Native Americans of that 19,000 plus number?
20.
Yeah, that's a pretty good guess. There were 31. So in the time that Dr. Ignace come in, those numbers were a little higher, but not by much. But to have a Native doctor serving a Native population and with an ability to answer these Native questions around our health is a very special thing. And we need to get more of our relatives listening, especially as we move into school, and especially as we move into those questions like, and we had one before about childhood cancer, right? And now we have a second one. There are special circumstances. All of our families can be 100% effective with bad information.
Sure.
With that, thanks, Dr. Ignace, for coming back to your community, serving our community, having this online conversation with a doctor that gets it. And please encourage your friends and relatives to be paying attention these next few weeks, because arming yourself and your families with the best information possible means a healthier family come October and November. Dr. Ignace, back to you.
Yeah, thanks, Mark. And it's really good to be back. Things are a little bit in a lull in terms of information. We all heard about Delta and the variants, and that's still an ongoing discussion. But I think the hotter topics that are going to happen are going to be coming in the upcoming weeks. And it really revolves around school, going back to school. What is that going to look like? What is that going to mean? Schools closures, mandates, masks, everything all over again. So now, I'm going to try to keep to the same format. I'm trying to be a little less data oriented and more informational. And so we're going to be transitioning here a little bit and maybe looking at every other week until things start heating up again. So I will do at least one more session for the end of the month, and then depending on how things are looking, I may keep the every other week, or if things get really hot, I may come back every week and making sure that we get updates. But I will continue to do this and keep everybody informed and up to date as much as possible of what's going on. So get vaccinated, check out those videos, don't laugh too hard, and everyone stay strong. Till next time.